Hey everybody, and welcome to the first disease-related episode of The Buzz, Parenting and Pediatrics, with me, Dr. B. Now, today we're going to talk about one of my favorite diseases, strep throat. You got to wonder, why does a doctor have a favorite disease? Well, this is a very common problem, so we see it a lot. It's easy to treat, we have good treatment options for it, and kids get over it relatively quickly. And that's a good thing because we want to get everyone back to doing what they want to do. By the end of this talk, I want you to be able to know what strep looks like, know how to prevent it, how we diagnose it, how we treat it, because we don't want you to get really worried about things and rush in and think, oh my gosh, this is going to be some terrible problem, and it turns out to be a viral sore throat or strep throat itself, which is, like I said, pretty easy to treat. And that brings up something. Sore throat is a very, very common problem in pediatrics. We see kids every day with sore throat. But probably only about 20-25% of the time will it actually be strep throat. That is a sore throat caused by a bacteria called Streptococcus pyogenes, or pyogenic strep, or group A strep. It has a lot of different names, but that's what strep throat is. Who gets strep throat? Well, typically our patient is going to be about 3 years to maybe 13 years old. You can get it outside of that age range, but it's not that common. I think the youngest child I ever saw who had strep throat, and it's pretty obvious and the tests were positive, was about 18 or 19 months old. You will sometimes get some older teenagers or even adults or even parents who get strep throat, but that's a lot less common. What strep likes to do is it likes to infect tonsils, and it likes to be around school-age kids because those are the ones who are all touching each other all the time. But if you don't have big tonsils, if you're very young, you won't have big tonsils. If you're older, you won't have big tonsils. Usually there's a very golden area where your tonsils are big enough, strep likes those tonsils, it gets in there, and that's when you get it. And that's going to be in school-age kids and younger middle school and younger high school kids. How do you get strep throat? Well, it's common to find this in kids who are sick, in their nasal secretions and their saliva. And what do kids do? They chew their fingernails, they pick their nose, they touch doorknobs, they give a pencil to someone, and then that kid touches it and sticks their finger in their mouth. And so it's very important to know how it's spread, because then we know how to prevent it. The best way to prevent this is, you guessed it, washing your hands. Pretty easy. When someone has strep throat, typically they're going to have a very, very sore throat. It's going to come on very quickly. They're going to have painful swallowing. Now, they shouldn't have difficulty swallowing. Difficulty swallowing and painful swallowing are two different things. Painful swallowing means you swallow and it hurts, right? Difficulty swallowing means you can't swallow. You swallow and things get stuck, or it doesn't feel like it's going down. That's a little bit different. So if they say, I can't swallow, you might want to say, well, do you mean you can swallow but it hurts, or you actually can't swallow? Because that's a big difference. So painful swallowing is what we're looking for. Headache and bellyache are often common symptoms of strep throat. And interestingly enough, we have diagnosed strep throat many times with someone who comes in with just headache and bellyache, and you look in there, you go, oh my gosh, your throat's all red. Is your throat painful? And the child will go, no, actually it's not hurting at all. It's just my headache and my bellyache. But that's one of the interesting things about strep. It can cause a terrible sore throat, or sometimes not much of a sore throat at all. But that's why we got to take a look at it. Now we're going to show you some pictures in a little bit. Some of those pictures are a little bit gnarly, but I think you'll be able to handle it. But it is important when your child says, I have a sore throat, you take a look in there, you can see what it might look like, and you might be able to give us some more information. Other things that you might see with strep throat are a fever, but again, you might not have a fever, and a rash. Now the rash, if they get a strep rash, I'm going to show you a picture here. We'll see if that comes up. But the rash and a fever and strep throat together forms a more exotic sounding disease called scarlet fever, but really that's all it is. Scarlet fever can have some more complications, but really it's just strep throat with a fever and a rash. Now the signs of strep throat, and I'm going to bring up a picture here, hopefully if I can get it to work. What you should be able to see in this picture is the back of someone's throat. And that little thing hanging down in the middle that looks like it's kinked off to the side, that is called the uvula. And if you look above that, you see all the red polka dots. Now those polka dots are not supposed to be there. And when you see that, along with what we call a beefy uvula, a little bit swollen uvula or swollen tonsils, that's a pretty good sign that this patient needs to be evaluated for strep. I'm not going to say that it's absolutely strep. This picture is of someone with strep throat, but that's what we're looking for. We're looking for those little polka dots in the back part of the palate, which we call the soft palate, right above the uvula. And we're looking for a beefy uvula. You might have some swelling of those tonsils. Some people say that you're going to see a lot of exudate with strep. That sometimes occurs if it's been in there for a while. If you have an older kid in their teens who has exudate or pus, grayish pus on the tonsils, well, you also have to consider they might have something called mononucleosis, which is caused by Epstein-Barr virus, and that is actually managed in a different way. So seeing pus on the tonsils is not a prerequisite for being diagnosed with strep, and sometimes it actually makes us think of something else altogether instead of strep. The next picture I'm going to show you is actually of the rash, and that rash that you might see with strep, you might see red cheeks and what's called perioral pallor. There's a little whiteness around the mouth and on the chin. And when you see the rash on the body, it's a very, well, they say salmon colored and fine sandpapery rash. That's a very common description. A salmon sandpaper rash. And that's something that we might see, especially with someone who has scarlet fever. Now, when we test kids for this, usually in our office, we do a rapid strep test, which is going to require us tickling the back of the throat. If the child goes, really loud and keeps doing that through the swabbing of the uvula and the tonsils, then they shouldn't gag as much. Hopefully they won't gag as much, but I got a hand to them. I mean, a lot of these kids are great. They don't gag at all. Me, I will throw up if you do that. When I was a kid, I always wanted to do it myself. Unfortunately, we can't let you let your child swab themselves, but we get through it really quickly. But that test takes about 5 minutes, and it should tell us whether or not they have strep. I'd say it's probably about 95% accurate. Now that sounds great, 95%, that's fantastic. But that means that 1 out of 20 times it's actually not correct. It might give us a false negative result or a false positive result. The other thing we can do is a culture. A culture takes 2 or 3 days. A lot of people don't want to wait that long, and they want to make a decision on this now. Very often, if you have strep and you swab and the rapid strep is negative, and you're gonna do a culture, are you gonna wait around for that? Are you gonna treat that? A lot of times, if you're in the ER or in urgent care, and I'm certainly not blaming anyone, but they'll say, look, we got to go ahead and treat this, even without a positive rapid strep test. For the medical students and the residents out there, you need to be very careful if you decide to do that, because there are some viruses that if you give the child amoxicillin for the strep throat, it can cause a horrible rash. And we can have another talk about that on another date. But that is something that your urgent care doctor or maybe even your PCP may decide to do, and it's something that you need to be very careful about, go over the medication choices and what side effects may show up. The treatment that we usually recommend for strep is going to take about 5 to 10 days, and it's going to be one of 2 or 3 different medications. If you can take amoxicillin, we have a positive result, we're going to use amoxicillin. That'll work. Usually we give that for 10 days. Keflex or cephalexin is a cephalosporin that can be taken as little as 5 days. Zithromax can be used. It is starting to show strep is starting to show some resistance to it, so we don't use that very often. So probably amoxicillin or Keflex is probably what we're going to reach for. Those are good tasting medicines, usually don't have a lot of side effects, and they work pretty well. Why are we going to treat this in the first place? Well, Streptococcus itself, while we can treat that and get rid of it pretty easily to prevent infection, that's a great thing. But if you don't treat it, there is a slightly higher incidence of having some pretty severe problems down the road. Heart problems, called rheumatic heart disease or rheumatic fever, can occur if you don't treat this appropriately and you get the right strain of Streptococcus. And so we want to avoid that. So treatment is always a good idea, in my opinion. After treatment, it's very important to do a few things. Number one, change your toothbrush. Child needs to change toothbrush. Usually we'll see the child, diagnose them, put them on antibiotics, and tell the parents, tonight use the toothbrush, tomorrow throw it away. You got to use a new toothbrush starting tomorrow. I also recommend changing sheets, towels, pillowcases, face cloths anything personal. We don't want to get reinfected, and we certainly don't want to infect anyone else in the house. And that brings up school. When can they go back to school? Well, a child really needs to have two things there. One, they've got to be on the medication for at least 24 hours. And two, they've got to be getting better. If they're not getting better, and there could be that the diagnosis is wrong, could be that the treatment is wrong, could be that there's more than one thing going on. So it's probably a good idea, if you're not getting better after a day or a day and a half, something like that, that you follow up with your doctor, find out what's going on and why they're not getting better. Another thing, probably the last thing I want to talk about, is tonsillectomy. A lot of people think, oh, I got strep throat, I got to get my tonsils out. And true enough, in the old days, you get strep throat, scarlet fever, first thing you're going to do, yank your tonsils out. I don't know if that's exactly accurate, but I know that happened to several of my siblings. But we try not to do that these days. A lot of times we treat you appropriately, change your toothbrush, make sure you're washing your hands. You may get it once or twice in your childhood. That's about as much as you're going to have to worry about. People who get it repeatedly, but even people who don't get strep throat repeatedly, they just get sore throats repeatedly, may in the end have to get their tonsils out. That's something that we leave up to the ENTs to decide. But after a few episodes of strep, or it keeps coming back, it keeps causing problems, the tonsils are looking sick, child's having trouble swallowing, that sort of thing, we're definitely going to have you see ENT and have that looked at. Well, that's about it for strep throat. If you have any questions about this discussion, then please ask them below. And please subscribe to our YouTube channel. We're going to keep talking about interesting things. The next thing we're going to talk about, I think, is measles, because it has been in the news and we all need to know what to look for on that. But subscribe. We're going to try to make 2 or 3 videos a week and talk about all the different things that people come to see us for and people have questions about. And please make your suggestions on what videos you'd like to see in the future. And this is Dr. B, and this has been The Buzz, and thanks for joining me. We'll see you next time.